Welcome to Tech Anatomy. I am thrilled to announce that Tech Anatomy is a partner of HIMSS 26 Europe, taking place in Copenhagen this year, May 19 to 21st. So to kick off the conversations leading up to the conference, I'm joined today by Dr. Mette Maria Skjøth, Chief Administrative Officer at Odense University Hospital and Chair of the HIMSS Europe EMEA Advisory Board. Mette Maria, thank you so much for joining me.
Thank you very much. I'm so happy to talk to you.
My first question is about this year's edition. What are the key themes and priorities that are shaping HIMSS 26 Europe this year, and how do they reflect where the European health tech space is heading?
So HIMSS Europe 26 in Copenhagen will dive into different areas, but areas such as AI, interoperability, cybersecurity, digital maturity, with a clear focus on actions to kind of accelerate smarter care delivery and also value. And this year, I'm very happy to see also there's a focus on women's health in the program. We're looking very much forward to that. So we're looking very much forward to also to host the conference in Copenhagen this year. Denmark has a long tradition with implementing health tech solution, and it's a great pleasure to welcome the HIMSS network in this setting.
You mentioned AI and interoperability. Those are topics we kind of expect to hear about. Women's health, not so much. What drove this choice?
So there's a great focus on putting spot to more research and more tech development in the area of women's health. So this has also been a huge initiative for HIMSS to set the focus on that, both the last year and also this year. Conference. So we're looking very much forward to input, but also debates around this area.
Is there any topic that you're particularly excited about personally?
Of course, I'm very excited about the women's health. I'm also very excited about the topic around AI. It's a huge topic, and it has a big potential within healthcare. And for us at the hospital setting, it's very interesting to have this debate among stakeholders, among vendors, and among public partners to kind of see where can we drive AI.
AI is obviously everywhere and it's highly anticipated. With both your roles that you're representing today, where do you see it actually make a real difference versus where do you still think that it's mostly hype?
So AI is of course a very big topic at a university hospital as ours. It's meant to be a huge game changer for the healthcare sector, and it will probably transform the way that we work, but also the way that we provide healthcare in the future. It covers kind of a wide range of new technology that are based on algorithms and learning systems. And some of the benefits that we kind of hope to achieve within healthcare is faster analysis. It could be identifying signs of diseases earlier, and in that hand also faster diagnostics. It could be more accurate diagnostics and also more tailored and accurate and maybe personalized treatment. It also gives the opportunity to kind of involve patients and relatives more in the decision making. And of course, we also see a lot of potential in streamlining the administrative workflow.
Do you have a particular project that comes to your mind when you describe all this that you could highlight?
One of the big projects we have at the moment at our hospital is around ambient scribe, with kind of AI-based speech-to-text solutions. So looking into how we potentially can reduce the burden of translating conversations between clinicians and patients into the medical record in real time. So it's focusing on the quality of documentation. It's also focused on time consumption and also user experience. And of course, there's also an economic impact.
And if we zoom out for a second and take a larger perspective, what is the biggest gap that you see between the promise of digital health and the reality that you see on the ground in European healthcare systems?
So one of the gaps that we have right now is kind of sharing data across sectors and also across countries. And some of that we're working with the European Health Data Space, but it still is a big issue of being able to sharing data in between systems. And also we have I would say a huge potential more than a huge problem, but scaling solutions. We see a lot of good solutions, but maybe they're not kind of scaled. Not even within countries, but definitely not outside countries. So there could be a lot of potential in exchanging more ideas and exchanging the good solution. And that's also some of the things that we hope to discuss at the HIMSS conference.
And do you believe that this gap that you're describing is mostly technological? Is it like cultural, organizational?
So it's probably a mixture. So because, the tech is definitely there, but the whole way of combining it and integrating in it to system is, of course, a challenge. But the whole organization, the culture, the kind of moving people from one solution to another, a lot about habits and how to change habits, that's definitely also a challenge and something that we work with ongoing. I would say that we have some very well-informed patients and very engaged patients who ask for better solutions. So that's also is a driver for us, of course.
To conclude this interview, for the audience who is listening to this episode and wondering if they should attend this year's edition of HIMSS Europe, what are for you some of the sessions or the conversation or the encounters that you think they should consider?
So I think that HIMSS Europe 26 will be a great opportunity for healthcare leaders, for innovators and for policymakers, private vendors from different countries to meet and get new inspiration and to exchange ideas. I think it will be 3 very inspiring days and a great opportunity to kind of dive deeper into the future of healthcare. There will be a very strong program with a variety of different sessions. So we definitely hope that the people will bring back 1 or 2 good ideas you can scale at home, maybe a clear approach to responsible AI, but also a stronger cross-country and cross-discipline network. So we really hope to see some great days in Copenhagen.
And I've attended HIMSS Europe for many years, and it's always such a delight to see this ecosystem grow and to see all these different stakeholders being reunited in the same place. So I completely agree with you on all the benefits and advantages that you've listed, and I can testify myself that it's such a rich space and place for a conversation. So thank you so much, Mette Maria, for taking the time to do this interview.
Of course, happy to share it.